False. It can affect anyone, but it is much more prevalent in women, especially after menopause. And this is because estrogen is highly protective against osteoporosis. So when estrogen rapidly declines during the menopause transition and then stays low, unless it's replaced with HRT, the risk of osteoporosis increases. It is very common. In fact, it's thought that 1 in 2 women over 50 will break a bone because of it, and 1 in 5 men over 50 will break a bone because of osteoporosis. This is false. There's lots that we can do to prevent and even in some cases counteract osteoporosis if it's caught early enough. Exercise is crucial throughout our lives, and to prevent osteoporosis, we need to include weight-bearing exercise and muscle strengthening exercise. Anything that strengthens muscles will also encourage the body to strengthen bones. So whether it's strength yoga, power walking up hills, squats in the kitchen, or doing a gym class, it's important to partake in strength training at least twice a week. Nutrition is also key, and certain nutrients such as calcium and vitamin D are required for maintaining strong bones. Smoking and consuming excessive amounts of alcohol can increase the risk, as can being very underweight or taking certain medicines for a long time, such as steroids. That's false. Well, not always anyway. Osteoporosis means that the bones are more fragile and therefore at increased risks of fractures and breaks. And it's then, if a bone breaks, the injury occurs and it's painful. Some people do get what are called crush fractures of the vertebrae bones that make up the spine, and this can be a very painful form of osteoporosis. False. In fact, exercise is the single most important thing you can do to protect your bones from osteoporosis. No matter where your starting point is, adding something into your day can make a big difference. In fact, it's the least active people that have the most to gain from just doing 10 minutes a day of something like seated exercise, or get into the habit of doing a set of squats each time the ad breaks comes on the TV, or press-ups on the kitchen bench when boiling the kettle. These can reduce the risks of fracture, but also reduce the risks of falls too. False. For most people, there are no symptoms until a bone is broken or fractured. However, some people do have symptoms, especially if bones in the spine become crushed. This can cause severe back pain, and it can also cause the person to lose height. It can cause a person's posture to change too, so that they look sort of in a forward stooped position.